Hi guys, end of an interesting day again at surgeries, and I thought it'll be nice to put this informative video together for all the lipoedema ladies out there to understand a little bit more about liposuction for lipoedema. It is not just a standard science that of just taking fat out. There are lots of points you have to consider to make sure you as the person remains safe after the procedure. Needless to remind, over the years we keep getting these stories, somebody died following liposuction, etc. So it's imperative we all understand what this is all about, especially when we're doing these modern day liposuction procedures where you're going to get it done under local anesthetic and go home. You're not going into a hospital to spend 2, 3, 4 nights in there. So it's imperative we only do so much work that you're safe, your body is safe to handle, and go back home in the comfort of your home with your family. So we just finished treating a 60 kilo girl, BMI of about 21, 22, not a big person. And this is something I see all the time where sometimes with lipedema patients, you have to do it in two sittings where you do one leg at a time. And correctly, these girls feel quite confused. Well, I'm not big. Why do I need to do it all in one go where someone else do it in 2 goes where someone else can do it in 1 go? So this is an attempt to make you understand what this is all about. So as a 60 kilo girl, this girl only had a maximum of this much anesthetic that could be used at a time, 1, 2, 3, 4 liters of it. I would probably say more, 3.5 liters of it, to be on the safer side, so there she remains safe. And then at the same time, she could only have about 3 liters of fat that could be safely removed as a maximum in one setting. And you could see it's all fat. There is absolutely nothing else, that fat that comes out. This is where it all comes down to the understanding. You can only use so much anesthetic and take out so much fat safely in one session. Now you could do that to all the areas, which means technically you still have a lot of fat left behind. Or you do one leg properly as we have done it, and you come back a week later to finish the rest, but that way you mean that way it means you've had all the fat removed as it should be in lipedema with no risk of it coming back. And I routinely see a lot of patients chasing us for corrective surgeries when they have fallen in with the ease of doing it in one go. Sometimes it could be slightly cheaper also, but then they fall for it, get it done, and very soon they realize that wasn't the case, because shape starts to change in a couple of months' time, everything starts to look more disfigured than it was before, and of course lipedema is still there. So hopefully this will help you understand what it means when somebody is saying we need to do it with so much of local anesthetic in one session or 2 sessions, because it's a lot more than understanding different types of techniques, online and in forums. So as I always say, it's never an obligation to see me. Feel free to come and approach me with your list of questions so I can make you understand what it means, what it involves, and then you can have a better understanding to make an informed decision. So if you want to see me, get in touch anytime. I'm available to give out my honest opinion and explain what it means with tumescent liposuction and what are the safety pointers. Until next time, take care and goodbye.